Hello my dear subscriber and viewers, welcome back to Akshara Akshita 2023 channel. In this video, I am going to explain about medical coding guidelines for hernia repair. There are some changes in hernia repairs in 2023. So those who are not subscribed my channel, please subscribe my channel and press the bell button, select all, then only you will get my future videos as notifications. So let's start coding guidelines for hernia repair. From hernia repair, definitely there will be one question from CPC exams. So I'm going to explain detailedly because this is very most important topic for CPC exam. So I'm going to explain detailedly. Please don't watch my video until end. Please don't skip in the middle so that you can get one clear idea. Okay guys, let's start definition of the hernia. So a bulging of organ or tissue through an abnormal opening. This is the definition of hernia. Okay, next is what are the types of hernia. So based on this type of hernia only we have the CPT codes list. So for inguinal hernia, either it is femoral hernia, lumbar hernia, anterior abdominal hernia and parastomal hernia. These last two hernia types, that is anterior abdominal hernia, parastomal hernia, from this types of hernia only there is the changes in 2023. Remaining hernia types, inguinal, femoral, lumbar hernia, old update only, but these last two hernia only we have the changes into 2023. Okay, so before going to the each hernia types of guidelines, let's see first some terms in the hernia repair treatment, like what is the initial, recurrent, what is the reducible, what is the incarcerator. These terms let's see first. Okay, so what is the initial hernia? Initial hernia means first time repair at this location. So patient does not have before this hernia, only first time patient is coming for this treatment or this disease means this is initial hernia. Okay, what is the recurrent hernia? Recurrent hernia is repeated hernia, more than one time means it is recurrent hernia. Okay, next is what is the reducible hernia. So based on reducible, non-reducible, that is incarcerated, we have the code. Each hernia type, each initial or recurrent, whatever it is, so we have two sets, either it is reducible hernia or incarcerated hernia. So you should know these terms. What is the when we can consider the reducible hernia, when we can consider the incarcerated hernia. Doctor may report directly the word of reducible or incarcerated strangulator. If not, we have to identify from the this meaning, from the meaning of this terms. Okay, so let's see what is the reducible hernia. Reducible hernia, when the content of the hernia sac return to their normal location spontaneously or by gentle manipulations by the doctor. So this hernia we have to consider as reducible hernia. So hernia can reduce by spontaneously or by gentle manipulations. This is called as reducible hernia. What is the incarcerated hernia? Incarcerated hernia is the content of incarcerated hernia or trapped in the hernia sac and cannot be pushed back. That means cannot reduce it by manually. So this is incarcerated hernia or more worrisome because they run greater likelihood of the becoming strangulator. So incarcerated hernia only we after some times become the strangulator. Okay, let's see the strangulator hernia, which is when the blood supply to an incarcerated hernia is cut off as vessel pass through the neck of the hernia. So blood vessels is cut off. That is the strangulated hernia. Blood supply it will stop. So incarcerated hernia converted to the strangulated hernia, became the strangulated hernia. So these are the terms we should know before selecting the CPT codes. Sometime if doctor will not tell incarcerator, obstruction also we can consider as the incarcerator CPT codes. Incarcerated, strangulator, obstruction or ovendum obstructions. These are terms we can consider as incarcerated CPT codes. Okay. Next, so already we saw some types of hernia. Based on this types of hernia only we have the CPT codes. Let's see first type, inguinal hernia. So coding guidelines for inguinal hernia. So inguinal hernia, before going to the select the CPT code, we need to look for the some points. The first point is we need to identify the whether it is initial hernia or recurrent hernia. Okay. Next, patient age. So age of the patient we need to check it. Based on that, CPT codes differentiated in inguinal hernia especially. Okay. So the first code set is preterm infant initial inguinal hernia. What is the preterm baby? So with the baby delivered before 37 weeks of the mother, that is called as preterm. If the baby delivered after 37 weeks, that baby should consider as full term. So the patient preterm infant, so initial inguinal hernia, there will be two codes, 49491, 49492. So 49491 is preterm infant younger than 37 weeks of gestation birth. So until before less younger than the up to younger than the 6 month. Okay, this is preterm. So the first code is reducible. Second code is incarcerated CPT code 49492. The next CPT code range is for full term initial inguinal hernia. The 49495 is full term infant younger than 6 month or preterm infant older than 50 weeks and younger than 6 month at the time of the delivery. Okay, and the time of the patient should be full term baby. So baby from the birth to younger than 6 month. So we need to use from this two codes. 49495 is for reducible, 49496 for incarcerated CPT code. Okay. Next code range is for age 6 month to younger than 5 years initial inguinal hernia. So the first code is 49500 for reducible, 49501 for incarcerated or strangulated CPT code. Okay, these two codes for 6 month to younger than 5 years CPT code. Next code set is for age 5 years or older. So initial inguinal hernia. 49505 is for reducible, 49507 is for incarcerated or strangulated CPT code. Okay. Next is, so now we saw only initial inguinal hernia based on the patient's age. Next is recurrent inguinal hernia. So for recurrent inguinal hernia, we don't need to look for patient age. So age of the patient, no need to check. So any age recurrent inguinal hernia, there will be two codes. One code for reducible 49520 and next code is for incarcerated or strangulated CPT code 49521 code. Okay, these two codes for recurrent inguinal hernia. For this recurrent inguinal hernia, no need to look for age of the patient. Okay. Next type of hernia is lumbar hernia repair. For lumbar hernia repair, we have only one CPT code 49540. This is direct code, so there is no point in this. Okay, next hernia type is femoral hernia. For femoral hernia also they have separated for initial and recurrent differently. So for femoral hernia also no need to look for patient age of the patient, no need to look. So any age initial femoral hernia CPT codes or 49550 for reducible, 49553 for incarcerator or strangulator CPT code. Okay. Then recurrent femoral hernia. Recurrent femoral hernia also differentiated with the either it is reducible or incarcerator or strangulated CPT code. So 4949555 is for reducible, 49557 is for incarcerated. Okay, this all about the hernia types in 2022 and 2023 also same concept, but anterior abdominal hernia is a different there is a changes in the 2023. So anterior abdominal hernia, so based on the some points they have describes the code. So first we need to check whether it is initial hernia or recurrent hernia. Okay, let's see the initial hernia first. First, after checking the initial hernia, then we need to check location of the hernia. Either it is epigastric, incisional, ventral, umbilical or Spiegelian hernia. So then in this 2023 guidelines, no need to look for either the approach is open approach or laparoscopy approach. So any approach, there is only one code, we need to use it. Okay. Then for ventral and incisional hernia in 2022 until 2022 we need to code implantation of mesh separately, but in 2023 including of implantation of mesh. So in code description itself says including of implantation of mesh. That means implantation of mesh CPT codes no need to code separately. So the code itself deleted in the 2023. So implantation of mesh CPT code is deleted. That procedure will be part of the main procedures. Okay. The next is we need to check either it is reducible or incarcerated. Okay. After checking these all points, next we need to check the length of the defect. So there will be three types of CPT codes based on the length of the defect. The first code is less than 3 cm, 49591 and 49592. First code is for reducible, second code is for incarcerated. Like that, from 3 cm to 10 cm, there will be two codes, one code for reducible and another code for incarcerated. 49593 and 49594. Okay. Then greater than 10 cm, 49595 for reducible, 49596 for incarcerated. So anterior abdominal hernia, we need to look for the site of the hernia and no need to check approach, any approach that we have to use only one code. Then implantation is included. Then we need to check whether it is initial or recurrent, then reducible or incarcerated, then length of the defect. Okay. So these points we need to look before finalizing the CPT code for anterior abdominal hernia. Same point will be applicable to the recurrent hernia. So check for site, either it is epigastric, incisional, ventral, umbilical, etc. Then any approach, then including implantation of hernia, so code will be deleted in 2023. Then check for either it is initial or recurrent, then identify the either it is reducible or incarcerated. Then the last finally we need to check for the length of the defect. So based on three type of centimeter. First is less than 3 cm, two codes 49613 for reducible, 49614 for incarcerated. The next is centimeter is 3 cm to 10 cm, 49615 for reducible, 49616 for incarcerated. Next third one is greater than 10 cm, 49617 for reducible, 49618 for incarcerated CPT code. Okay, these are the changes in the 2023 for anterior abdominal hernia, and one more type also changes in the 2023, that is parastomal hernia. So parastomal hernia, so no need to check for the approach. For open and laparoscopy, for both approach there is only one code we need to use. And here also implantation is included because implantation of a mesh is deleted in the 2023. Then this implantation of mesh is included in the main procedures, and code description also they have mentioned including of implantation of mesh. So then need to check the either it is initial or recurrent, then identify the reducible or non-reducible, that is incarcerated. Then the code is 49621 for reducible CPT code and 49622 for incarcerated CPT codes. That's all about the changes in the 2023, remaining all the same as 2022. Okay, so let's see what are the codes are deleted, what are the new codes are added. Some summary of 2023 CPT coding changes we'll check. First, deleted codes, code range from 49560 to 49590, so which describes open repair of anterior abdominal hernia. Then deleted codes 49652 to 49657, which describe laparoscopy repair of anterior abdominal hernia. So in 2022 we have separate code for open method and separate code for laparoscopy method, but both are deleted. We have only one code in 2022, either open or laparoscopy we need to use only one code. Okay, so then deleted add-on code 49568, as I told you, which describes implantation of mesh for open of ventral and incisional hernia. So this code is deleted in 2023. Okay, then added 12 new codes 495912, 49596 and 49613 to 49618 to report anterior abdominal hernia repair by any method. Okay, then two new codes added for parastomal hernia, any approach, 49621 and 49622. Okay, then added one new add-on code 49623 for removal of mesh or prosthesis at the time of initial or recurrent anterior abdominal hernia repair or parastomal hernia repair. So whenever other site is doing parastomal hernia abdominal or parastomal hernia repair, if they are removing previous measures, removing with this procedure, means for removing code they have introduced newly in the 2023 CPT editions. Okay, then added one new code from one series 15778 for implantation of absorbable mesh or other processes for delayed closure of external genitalia, perineum, abnormal wall defect due to soft tissue of trauma. Okay, so these are the changes in the 2023 in hernia repair. Okay, if you have any doubt in this topic, please comment, and if you like this video, please like and share to your friends also. So in next topic I am going to explain about coding guidelines for ENM 2023. There is a huge changes in 2023 from ENM topic. So as per our subscriber and viewers requested to ENM coding guidelines, so before starting the 5 series I am going to post ENM coding guidelines in next in few days. Okay, those who are not subscribe my channel, please subscribe my channel and share to your friends also. And what are the topics I covered so far, I have posted my all theoretical to my blog, so please check my blog. That blog links I have shared in the description box. Please click on that link and go through the theoretical each topics. So I hope that will be useful for theoretically. Then okay guys, thank you for watching my video. Thank you so much. Bye bye.